Well, I was a little nervous leading up to the surgery. The day before, I was almost thinking about canceling, to be honest, because the thought of being awake during the whole procedure, I think, scared me more than the procedure itself.
Upper lid blepharoplasty is done under local anesthetic with the patients awake, and that's really important because it allows me to mark the creases when patients are upright. I can have them open and close their eyes voluntarily so I can see how their creases form, and this is a really important part of getting a nice result. Now, this is not an uncomfortable procedure. A small amount of local anesthetic is placed into the eyelid skin, and then the patients don't feel anything.
When I came to the day of the surgery, I was made to feel very comfortable to begin with, and it was actually a lot easier than I anticipated it would be. It's a little different, I guess, hearing what's going on, but it relatively happened very quickly, and by the end I was actually surprised it was so quick, and really, I think, like I said, my imagination got the better of me beforehand.
Sometimes patients will hear me talking, or they'll hear the instruments that I'm using. The eyes are closed during the procedure or when I'm doing any of the surgical work. The eyes are only open when I ask them to open and close so I can assess how their creases look. So it sounds a little bit disconcerting for some people to be able to hear me using a stitch or cutting through the skin, but it's not something that they feel. For patients who are particularly nervous, they do have the option of taking an oral sedative. An oral sedative relaxes patients and it often makes them a little bit drowsy, and sometimes they'll doze off and sleep during the procedure.
In the end, if I could say one thing to people, is that it's really not as bad as you could imagine. It's actually easier than going to the dentist.